2021, Medicare Advantage, Medicare Supplement, all these different options. Which plan is the right one for 2021? Hi, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office. My agents and I, we assist people with their Medicare nationwide. There are so many different options out there right now that you're seeing because it's annual enrollment. You're seeing Medicare Advantage, all-in-one plans. You're seeing Medicare Supplement plans. You're getting stuff in the mail, you're hearing stuff on the radio, seeing TV commercials every few minutes on TV. I'm seeing them too. You're getting randomly phone called from different people talking about different plans. Let me help you take some pressure off of your Medicare decision for 2021. There's really not going to be a bad choice. So just full disclosure, my name is Robert Bache. I'm a licensed agent. People call me MedicareBob. I do not work for the government. These are just my thoughts, my overviews of the landscape right now that I'm seeing for Medicare for 2021. These are not coming from a carrier or a company. This is just me and my 12 years experience of helping over 100,000 people enroll with my company and what I'm seeing right now in annual enrollment for the landscape for 2021. Take the pressure off. That's my advice. Here's the reality. The biggest decision you need to make is, do you want a Medicare Advantage or a Medicare Supplement plan? Once you make that decision, the pressure should be reduced, because if you choose Medicare Advantage, I'll go over that the landscape on those plans, they're all starting to kind of look alike. And the changes for 2021 are all pretty positive. For 2021, we're seeing on most plans lower doctor copays, lower specialist copays, lower out-of-pocket costs. We're seeing more bells and whistles, like transportation, meal plans, dental, vision, hearing. But really, they're all starting to look alike. I mean, if you take a piece of paper and in most counties take a look at the 3 most competitive plans when it comes to Medicare Advantage, they all look pretty similar. So I'm saying that because even though there's a lot of options, if Medicare Advantage is the way you want to go, across the board, most of them have improved from 2020 to 2021. Improving meaning still very low premium. Some are 0 premium, which of course you still have to pay your Medicare Part B premium, but there's no additional premium. That's what that means when you see 0 premium. They're not actually free. You still do pay your Medicare Part B premium. But HMO, PPOs, the benefits, most of the plans are really starting to look alike. So just don't put so much pressure on yourself on, which one is the right one for you. I would investigate and then make an educated decision. And then, you're probably going to be fine either way, because maybe your plan doesn't have the extra $200 in dental that this one does, but maybe it has an extra $500 in vision. So, they're all starting to look very similar on the Medicare Advantage side. And the good news for 2021 is they're getting better. We're seeing lower drug costs on insulin, some other prescriptions on most plans. Again, all those lower costs. So it's a positive thing that we're seeing in 2021 for Medicare Advantage. So if that's what you want, then, try to take some pressure off of you, make a choice, go with it, and you'll probably be very happy for next year. Looking at Medicare Supplement insurance, same kind of deal, right? Like, we didn't see a huge change. If you have a Medicare Supplement plan, there's 3 plans that you probably have: Plan F, Plan G, and Plan N. The 2 more popular plans now, with what happened with the macro changes to Plan F, the 2 more popular plans are Plan G and Plan N. And if you have Plan G, that's a true Medicare supplement. You keep the right to go to any doctor, any hospital. And then once you pay the Medicare Part B deductible, Medicare is going to pay 80% and the Plan G pays the 20%. So the only opportunity for change there is the Part B deductible. Well, the deductible in 2020 was $198. For 2021, it's going to be $203. So it's only increasing by $5. So that's not a big change, right? If you have Plan G and you were used to paying $198, I mean, for me, I always rounded that up to $200 anyways. Well, now it's $203, which to me, I guess I would kind of round down there and say it's $200. So, if you have Plan G, you still have a round of $200 deductible, and then Medicare is going to pay 80%, and your supplement plan pays the 20%. Similar to Plan N, right? The Plan N has 4 out-of-pocket costs. It has the Part B deductible, $20 copay, that didn't change for doctor, $50 copay for ER, that didn't change. The percentage you pay for Part B excess charges, that didn't change. So the only benefit that changed there is the Part B deductible, which again went up $5, went from $198 to $203. So if you're in the supplement world, the changes for you is we do have some very competitive carriers that are entering the market, and also some of the legacy carriers that are in the market are coming out with household discounts as a way to lower their premium payments. So I do encourage you to shop your Medicare supplement for 2021. Remember, the December 7th deadline doesn't apply to you on your supplement. You can actually shop that all year long in 2021. So the message for Medicare overall for changes from 2020 to 2021 are mostly positive, meaning, I know with my customers and we just expect things to increase and go up. So the fact that the Medicare Part B premium only increased by about $4, that's just kind of like, we're used to that. So that's not a big deal. We've seen years where it's increased more. So that's a positive for 2021. The Part B deductible, we've seen that sometimes increase $10 to $12 over a course of a year. It's only going up a few dollars, going from $198 to $203. So that's a plus. And we're seeing some more discounts on the supplement side to make rates more competitive. So overall, the changes for 2021 are pretty minor. And if they are, they're mostly positive. So again, the biggest choice is what's right for you, Medicare Advantage or Medicare Supplement. I'm going to give you my T-chart that I do to help people decide on what type of coverage is right for them. The most important part of making that decision is understanding that if you choose a Medicare Advantage and you later want to go to a Medicare Supplement, you will have to medically qualify to do that. And that's a big deal because, when you look at Medicare Advantage at a cost basis, we're used to, when it comes to insurance, only looking at premium. So when we see a Medicare Advantage advertised on TV or the radio or in the mail, all-in-one inclusive plans for zero premium, we think, oh, wow, I should go with that. And that's not a bad option as long as you first understand that you are, most cases, still going to pay your Medicare Part B premium. So you're still going to pay that out of your Social Security check for most people. It's about $148 for most people in 2021. So you're still going to pay that. And then the reason is the same price as Medicare when it comes to Medicare Advantage is because it doesn't fill in the holes to Medicare. It just changes them around. So if you go to the doctor, Medicare is not going to pay $80, and you pay $20. Instead, that Advantage plan is going to charge you a copay. Could be $5, could be $15, depending on the plan you choose. If you go to the hospital, Medicare Advantage is not going to pay your hospital bills like a supplement would. Instead, it's going to charge you a different amount. It's going to charge you, again, depending on where you live in your plan, anywhere from $150 a day to $500 a day, depending on the plan. It also doesn't pay the 20% that Medicare doesn't pay because, again, on a Medicare Advantage, it's an alternative to Medicare. It's its own health plan. So as long as you understand what you're getting, that's not a bad option. So that's one option. Just understand with Medicare Advantage, you're going to have to go to certain doctors. It's going to be an HMO or PPO. It's going to be lower cost per month, but you're going to have copays up to your max out of pocket, which what we're seeing for 2021 is between $4,000 and $10,000, depending on your plan. The big caveat there is if you choose Advantage, the reason I'm saying this is, you might be drawn to those, of course, when you see the zero premium, as I talked about, advertised that way. But the reality is you are going to have copays, go to certain doctors. And if you choose that plan and later want to upgrade to a supplement, you may not be able to because you'll have to go through a health screening process, which is health questions and an underwriter interview in most cases to qualify. So just realize that if you choose Advantage, that's okay. You are just taking a risk that you may never go to a supplement, which might be fine with you. And then if you're having a lot of pressure on which Medicare Advantage to go with for 2021, looping this back into what I started the video with, take some pressure off. Most of the plans in your area are going to look very similar. So check with your doctor to see what plans they take. Talk to an agent or broker that represents multiple plans. Get it narrowed down to 1 to 2, and you'll probably be very happy with whatever Advantage plan you choose. On the other side of the T-charts, Medicare Supplement. The way that works is you're going to continue to pay your Medicare Part B premium. In return, you're going to use your Medicare red, white, and blue card. You're going to be able to go to any doctor, any hospital, have nationwide coverage as long as they accept Medicare. So you never have to get a referral or anything like that. You're going to pay an insurance company an additional premium for a supplement. But in return, you keep your right to go to any doctor, any hospital. And it's actually going to pay the 80% that Medicare, it's actually going to pay the 20% that Medicare doesn't pay. And then once you're in that plan, you can't be kicked out due to your health. So even if you choose a supplement and let's say you do get cancer, God forbid, or have an expensive open heart surgery or cataract or something like that, they can't raise your price because your personal health costs, and they can't kick you out because your personal health. And that's a really big deal, and that's a reason to choose a supplement over an advantage, if you're looking for that. The biggest thing I would encourage you to do when you are making your Medicare choice is, if you are healthy, just think about you're not necessarily making your health insurance choice for right now. You need to make it for the future, because if you choose an advantage, again, and later you want to upgrade, you may not be able to. And if you choose a supplement plan, you want to make sure you're choosing the right supplement, because you may not be, even though you can't get kicked out, if you want to switch to a different supplement, you would also have to medically qualify. So to summarize this video, the outlook for Medicare for 2021 is stability. Minor negative adjustments, minor increases on the Part B premium and the Part B deductible. But if you have a supplement, that's reasonable. And then if you're going with Medicare Advantage, there's really not going to be a bad choice as long as you look at the plan and feel comfortable with it, and you understand that that could be the plan that you're stuck with, because if you want to switch to a supplement, you'd have to medically qualify down the road. I know it's overwhelming, and you don't have to become an expert at Medicare. I would advise you to work with an expert or a advocate, an agent, a broker. Work with a broker that represents multiple companies and carriers so that they actually are doing the work for you and not just for that carrier. If you'd like a broker that represents all the top carriers, Medicare Advantage, Medicare Supplement, and Part D, I recommend working with Senior Healthcare Direct, MedicareBob's office. All of our agents are AHIP certified, so they're certified to talk to you about prescription drug costs and Medicare Advantage and Medicare Supplement. We have an A+ rating with the Better Business Bureau, and we have over 100,000 followers on Facebook. In the description of this video, I'll drop a link to follow us on YouTube, Facebook, all the social stuff. But if you need a question answered, I'll also put the phone number in the video and in the description. Just give us a call, spend a few minutes with us, and we can really, really make Medicare easy for you.